We're going to be talking about infection today, prevention of infection, and infection control. We want to define infection and learn how to prevent things like infections from happening, bacteria versus viruses, the chain of infection. We're going to talk about healthcare acquired infections or healthcare associated infections, hand hygiene, standard precautions and PPE, and isolation. Infection and infection prevention. So what is an infection? It's the entry of a disease-causing microorganism or pathogen into the body. It disrupts tissue and or results in illness and disease. If it's left untreated, it proliferates and takes hold and makes you sick. There is a specific link, six-link chain of infection, and you need to know the different links that are required to make a continuous chain in order for an infection to take hold. Breaking any link in this chain can stop the cross-contamination, can stop the infection from getting to the next host. You have to have a causative agent. This is any pathogen or microorganism like a bacteria, virus, protozoa, prions, rickettsia, fungi, helminth. That's a funny word. These are all causative agents, microorganisms that can be causative agents to cause an infection. You have to have a reservoir, the place where these microorganisms are found. These could be things like an infected wound, an animal or human waste pile, contaminated food or water somewhere that this causative agent can stay and linger and survive long enough to get to the next host. You have to have an exit or a portal of exit, a way for this pathogen to leave the body of the infected host or the wound or the animal waste pile or the contaminated food or water. There has to be some way for the pathogen to get out of that host through feces, sputum, blood, urine, body secretions. Somehow it gets out of the host that it was in before. There has to be a mode of transfer. This could be direct personal contact with body secretions or contaminated solids or fluids. This could also be indirect, like a contaminated inanimate object like your spoons and forks and your glassware, glasses that you're drinking, or your plates, dishes, soiled dressings, hospital equipment. Vectors, like a vector is something that would carry this pathogen, like a flea or a tick or a mosquito. It carries the pathogen and bites or injects that directly into another host. Those are called vectors. It could be droplets, sprayed droplets or aerosol spread from one part of the body to another is another way for infections to spread. You have to have a portal of entry, some way for these little germs to get into the body. Could be through mucous membranes, like through your eyes, nose, mouth, trachea, or in any body orifice, or it could be just a break in the skin. You have to have a susceptible host. Finally, the susceptible host is the last link in this chain. A human body can be a susceptible host if there's breaks in the skin, if there's immunity is low, or this could be because of their age, like they're very, very old and don't have the immunity they used to, or they're very, very young and have not yet built up an immunity to a lot of these germs. Good health and hygiene practices as well as immunizations will help prevent the susceptibility of humans so that they're not a susceptible host and hopefully prevent the spread of infection. What is an HAI? You're going to hear this a lot. This is a healthcare associated infection. They used to say healthcare acquired infection. That's another way to say it. This is because it doesn't happen until you're in the healthcare facility. This is often due from cross-contamination from other infected people, or the healthcare worker has contaminated hands or objects, and they go from one to the other and they contaminate um, the healthy person with the infected person's germs. Hand hygiene. I'm sure you've already heard about this. Now, how long are you supposed to scrub your hands? According to the CDC, they're telling us at least 15 seconds. I've seen some variations on this, but the CDC in 2019 said 15 seconds was the minimal expected scrub time for hands. The most effective way to prevent cross-contamination is good hand hygiene. Gloves should always be worn when there's contact with blood or body fluids of any kind. Hand hygiene should be performed before and after patient care. You can use hand sanitizer, those alcohol-based hand sanitizers, in between patient contact if your hands are not visibly soiled. And even with that, you should still perform good old-fashioned soap and water after 3 or so uses of the hand sanitizer. Don't just rely on the hand sanitizer. The hand sanitizer, alcohol-based sanitizers, are the most effective way to remove the microorganisms from your hands. It's alcohol-based, and also the physical rubbing of your hands will help remove some of those microorganisms from the surface of your hands. The CDC says this is the most effective way between patients for the healthcare worker. However, if your hands are visibly soiled or your gloves are visibly soiled, it's still best, if you're really dealing with some messy stuff, to take those gloves off and use soap and water if your hands become visibly soiled at all. At least 15 seconds. Healthcare workers really should not be wearing artificial nails, nail polish. It's just a bad idea. If it's chipped at all, those little microorganisms take hold and live under the nail polish. They live under your nails that are longer than a 1/4 inch long from the tip of your finger. You don't want them to be very long. It's just a place for germs to hang out and hide. You can't get that scrubbed out from under there in between each patient very well. So don't wear rings where the germs can hide under the rings, or the jewelry, bangles, bracelets, but specifically no artificial nails, long nails, or nail polish. Never, never, never touch anything with your bare hands that contains body fluids or fluids from a body surface or cavity. Gloves should be worn for any contact with saliva, urine, feces, blood. The only time that gloves are not worn is if the skin is intact or articles are not soiled. So, even if you're touching a patient with your bare hands with intact skin, afterwards you still want to sanitize in between, not sanitize, do hand hygiene in between with the alcohol-based scrub. And if you do touch anything accidentally with the bare hands, you immediately want to go clean with soap and water. Standard precautions are the method for avoiding direct contact with body secretions except sweat. This includes both gloves and hand hygiene. You want to treat all of your patients the same. This is why it's a standard precaution. You're not just treating certain people. You don't wear gloves just for certain people. Used to be healthcare workers didn't worry as much as they should about wearing gloves, and people would actually get offended if you put gloves on. They would say, well, why are you putting those on? I don't have AIDS, or I don't have any infections. It's now the standard. It is the standard precaution that we treat everybody the same, and we use gloves for everybody for the same reasons. Personal protective equipment, you're going to hear those words quite a bit. This includes gloves. It also includes gowns, goggles, masks, shoe covers, but we're talking specifically here about gloves. You do want to know in what order that PPE or personal protective equipment should be put on and taken off. This is called donning or putting on, or doffing and taking off. If PPE is required for isolation purposes and you have to put all the things on, it's done in the following order. It should first be the gown, followed by the mask, then a respirator or mask, then the goggles, or face shield. And finally, the gloves. The gloves are what you put on last. And to take these off, it's the opposite order. So you take the gloves off first, not touching any of the soiled PPE to your skin or your clothing. The front of everything and your gloves and the front of your goggles, those are all considered contaminated after you're done with them, and you don't want to touch that part of them. There's going to be a video here at the end I'll show you that will demonstrate putting on and taking off these PPE in the correct sequence. Standard precautions is the term used to describe the infection prevention practices practices applied to all clients, whether or not they're known to have an infectious agent. So like we said, treat everybody the same. Excuse me. Transmission-based precautions. Now we're going to talk about these things like PPE, cleaning, sterilization, isolation. Here's that video for donning and doffing, and it also includes specific transmission-based precautions for the different diseases that people could be in different kinds of isolation for. So first of all, let's talk about the transmission-based precautions can be used in combination with standard precautions. This is just a way of interrupting that mode of transmission. It identifies specific secretions that might be infective. So depending on what you're dealing with, if it is a C. diff infection or if it's a respiratory, more like a tuberculosis, where you wear an N95 mask, there's different types of transmission-based precautions that you would take in addition to your regular standard precautions. The first thing we can talk about would be the PPE. Use different kinds of PPE for different things. So if it's just contact isolation, like C. difficile, you may have to wear gloves, goggles, mask, just a regular mask. You definitely want to wear the gown over your clothes because it's contact. Anything you contact could spread that C. difficile. C. diff is highly transmissible. It's easy to spread. If you've ever worked in a long-term care facility, you know that if one person gets it, it's so easy to accidentally spread amongst everyone, and it doesn't take very much to spread that with linens, unclean hands. And when I say unclean hands, you cannot just use hand sanitizer with a C. diff patient. You have to wash your hands with soap and water, even if you've had gloves on the whole time. When you take those gloves off and you leave that room, immediately you're going to wash your hands. You don't want to spread that. Something that's aerosol, or well, there's different kinds of, there's droplet precautions where the saliva or the droplets that they sneeze are heavy enough that they will, go out a little ways and then fall down to the ground. Those kind of things, you don't want to get splashed with sneeze or sprayed. So you're going to wear the goggles, you're going to wear the surgical mask and the gown. Now, if it were something that was more aerosolized, like our coronavirus or our TB, tuberculosis, those are things that are aerosolized. And what I mean by that is that spray of a cough or a sneeze, it hangs in the air. The particles are so little, they kind of float around and hang in the air for a long time. And so it's easier to inhale and get those into the next host. You have to wear special mask for that. You have to wear that N95 particulate mask for those, or even a respirator. You also may have to put that person in a negative pressure room. So these are different types of isolation for different types of disease process. You also need to know what types of cleaning and disinfection is needed for the different types of problems. More cleaning for the more contagious types or pathogens. Cleaning and disinfection, that's just the physical scrubbing with soap and water and or the use of disinfecting chemical agents to clean and get rid of those germs, to kill the germs appropriately, depending on which germs you're trying to kill. Sterilization, this is stuff that, like in the surgical scene, sterilization can be done with heat, steam, and pressure, like your autoclave, where you have to bring it up to a certain temp for 15 to 30 minutes. a certain temp at certain pressure, or it could be a chemical like a gas or a liquid. First, you physically scrub off the debris that's visible, and then you put it in the autoclave and it's sterilized. That way it is safe to use in a sterile procedure or operation. Isolation, the different kinds of isolation, like what we talked about, there is a link here. Um, the doffing, donning, and transmission-based precautions. This also discusses the different types of isolation, like we had mentioned earlier. I do want you to go through this. You can't click on it during this video, but if you pull up the PowerPoint and just look through it, you can go and click on that. It's a direct link to the different types of isolation as well as doffing and donning the PPE. Then there is a disposal of sharps link as well. This is specific to needle recapping. We say we never recap needles, but in a rare instance where you have to, this is the only safe way, the one-hand scoop demonstration of how to put that cap back on. But in general, we do not recap needles. It's just not safe to do. There's a lot of different safety devices on needles nowadays that we shouldn't have to recap needles, but once in a while, there it is, a situation that calls for that, and this is the only way to safely do it, and that link is on there as well. A few more things to talk about: the disposal of the sharps themselves. You always want to put them in a sharps container, which is a puncture resistant container. You've seen them on the walls at the facilities, those little dumpster bins that are just for the sharps. You don't have to put the whole syringe in there. If the needle comes loose from it, you can put just the needle in it, but anything that's sharp and can puncture needs to go in a puncture-proof container, the sharps container. If you're in the person's home, they in home health, you may have to use something like a coffee can or maybe even a milk jug with the cap so that it's puncture resistant. You don't want to just throw sharps away in the trash where someone else can be exposed and have a needle stick exposure to those contaminated items. And when any of these containers are 2/3 full, we don't wait till they're completely full where you could accidentally poke yourself when you're trying to throw something in there. 2/3 full is when you should change those out and get a new one. And like we said, we never recap the needles. However, there is once in a while a certain situation where you may have to recap a needle. This is a link to the only proper way to do that. Then we need to talk about contaminated waste. So contaminated waste, specifically biohazard waste, these are anything that's gooey that can be flung, or solids of any kind that are biohazard. They need to be sealed up in an impermeable plastic container, bagged, and then put in a plastic bag marked biohazard. Soiled linens in the hospitals are treated like biohazard material basically, but they are put in linen bags, plastic bags in the room, sealed up in the room, and then your gloves are removed before you take that out into the hallway. The bag is closed in the room with your gloves inside of it. You don't wear soiled or used gloves out in the hallway, even when you're transporting this bag of linen. Once you've bagged it up in the room with your gloves, and you take your gloves off, and then you take that bag to the proper area to put it in, like a laundry receptacle. But you never just carry soiled linens through the hall, and you don't wear soiled gloves in the hallways. Those are ways of transmitting germs, and we don't want to do that. Finally, we're going to talk about isolation. We've mentioned there's a few different kinds of isolation. There's different reasons for patients to have isolation precautions. We need to know specifically if it is air, if it's droplet, if it's contact, or if it's an aerosolized situation like TB or COVID. The transmission-based isolation precautions, these people are at an increased risk for self-esteem and sensory deprivation. If you can imagine, you don't feel well, you're sick, and then they close the door and put a sign on your door that says no visitors, or visitors must speak with the nurse before entry. People hesitate to go in your room because they don't want to doff and don all that PPE. So you're going to have less contact even with the staff. They're going to bundle their care or only come in and do several things at once while they're in there. They're not going to come in and out freely. You tend to get isolated, lonely, plus you don't feel good. The sensory deprivation, nobody to talk to. It's just you in there by yourself. So boredom, slow thought, disorganized thought, excessive sleeping during the day. They may even get anxious or hallucinate. Some people even get panic attacks. They feel like they're locked up. So what are you going to do to help these people? You want to listen to their feelings. Still go in there, and when you're in there, definitely interact with them. Try to make some positive comments about what they are trying to do, any activity, or if they, hey, I see you gotten up and gotten yourself dressed. That's great. You're looking really good today. You want to engage that patient in some meaningful conversation. Maybe try to find out what their interests are or hobbies. Maybe see if you can find something that they're interested in that relates to their interests or hobbies. I mean, on TV, of course, or if there's any way to offer them some insight in a program or a show that they might want to see, or hopefully they have some kind of cable channels that might be of interest to them. Or maybe they, just want to talk about, hey, they have a favorite football team or something, and they've been following the football team, and you know that team, and you could converse about that. You want to make visitors feel welcome. If they do come to visit the patient, and encourage them, it's not that you can't go in, but you do have to put on this PPE so that you don't get contaminated yourself. Explain what the precautions are for and why, but you still want to make them feel welcome and understand that the patient benefits greatly from their presence. And if they cannot physically go in the room, encourage them to call on the phone. I mean, just that contact is going to help quite a bit. Addressing self-esteem needs is important for their recovery, and this doesn't matter what age they are. Self-esteem is very important, and that interaction, that human contact, regardless of the patient's age. That's it. That's all I've got for you on the isolation. You want to be sure that you've read chapter 16 and 17. It has a lot more information in those chapters. This is just kind of a brief overall. There again, we've talked about a lot of things. We've included a lot of things here, but there are a couple links, videos that I think are worth watching. And I hope you enjoyed this presentation.